Important ultrasound diagnosis of the liver diseases. Fatty liver. Fat accumulation is one of the most common abnormalities of the liver depicted on cross-sectional images. Common patterns include diffuse fat accumulation with focal sparing, and focal fat accumulation in an otherwise normal liver. Unusual patterns that may cause diagnostic confusion by mimicking neoplastic, inflammatory, or vascular conditions include multinodular and perivascular accumulation. Hepatic hemangiomas are benign tumors of the liver consisting of clusters of blood-filled cavities, lined by endothelial cells, fed by the hepatic artery. The vast majorities are asymptomatic. Typical hemangiomas, the so-called capillary hemangiomas, range from a few millimeter to 3 centimeters, do not increase in size. Small, less than 3 centimeters, and medium, 3 centimeters to 10 centimeters, hemangiomas are well-defined lesions, requiring no active treatment beside regular follow-ups. However, the so-called giant liver hemangiomas, of up to 10 centimeters most commonly, and even more than 20 centimeters in size, and usually will develop symptoms and complications that require prompt surgical intervention or other kind of therapy. Hepatic hemangiomas belong to the class of hepatic incidentalomas, so called because they are diagnosed incidentally. Liver cirrhosis. Distortion and replacement of normal liver parenchyma by fibrous and regenerative tissue complicate the appearance of benign and malignant lesions in cirrhotic livers. Cirrhosis is the end stage of chronic liver disease and causes architectural distortion and perfusional anomalies. It is a major risk factor for developing hepatocellular carcinoma. Common disease entities in non-cirrhotic livers, such as hemangiomas, can be rare in cirrhotic livers, and benign entities such as confluent hepatic fibrosis and focal nodular hyperplasia-like lesions may mimic the appearance of malignancies. Hepatocellular carcinoma is a malignancy that predominantly occurs in the setting of cirrhosis. Its incidence is rising worldwide. Hepatocellular carcinoma differs from most malignancies because it is commonly diagnosed on the basis of imaging features alone, without histologic confirmation. Focal liver lesions identified at ultrasonographic surveillance in patients with cirrhosis require further investigation. Lesions larger than 1 centimeter should be assessed with multiphasic computed tomography or magnetic resonance imaging.